Please, if we could have the panelists from the first two panels this morning join us here and arrange yourselves, if possible, in the order in which you presented today. I've been asked to reintroduce you for those who are joining this session by web. This is the first of 3 town hall sessions that will occur during our 2 days of meetings as a committee. Joining me here now are the panelists again that earlier presented today. Dr. Jim Sallis, professor at the University of California, San Diego, and director of active living and research at Robert Wood Johnson. Robert Garcia, founder and executive director of the City Project in Los Angeles, a man who gives lawyers a good name. Dr. Myron Floyd, a professor at North Carolina State University. And then from the second panel, and just most recently presenting, Dr. Mary Story, senior associate dean and professor at the University of Minnesota in Minneapolis. Don Schwarz, the deputy mayor for Health Opportunity and health commissioner for the city of Philadelphia, and Tracy Fox, who is the president of Food Nutrition and Policy Consultants. Each has a lavalier mic. Each, I've been advised, should be told to try to move it to the center, if at all possible, as close to your mouth as you can, so that the web broadcast will pick up this section of our session today. For the first half of this, we're going to have questions and comments from the audience. There are a number of people who have prepared statements, and we have scheduled them for the second half of this town hall section. So the prepared statements will begin in about 30 minutes. During this question and answer period, we have 2 microphones here. And for the purposes of the web, by the way, anywhere you are in the room, it has already been revealed to the world that you are here. So you can simply control for that in your explanations for what you've been doing today. But if you want to be particularly attractive to the web audience, you need to go to those 2 microphones. If that's not possible, we can bring a handheld microphone to you. And I would ask now, if you have a question or comment for the panel or for the work that we're talking about here today, please now approach one of those 2 microphones and ask your question.
Well, I'm going to begin the discussion hoping that others will come forward. I'm Lynn Parker with the Institute of Medicine. I forgot to introduce myself before as I hop up and down from the podium. And I'm going to, I hope that many of you will think about your questions as I'm asking mine and we talk about it, because it will bring up important issues both to the webcast audience as well as in the summary that we write about what happens during this workshop and gets the word out about a lot of important issues. So please be thinking and don't be afraid to ask a question. My question is based part on what Robert Garcia mentioned, that there was an overwhelming voter support of the park bond measures in California, particularly among African American voters. I was really impressed by the percentages. And I also think that in talking about building the context, which Don talked about, again, creating the awareness and bringing out the concerns of people in the community and showing them how they can express their views and get things to happen. I find that really exciting and fascinating, and I wondered if you could speak more to how that happens. How, Robert, did this voter response become so high and the awareness and interest become so high? And Don, how do you build that kind of context?
In terms of the support among people of color for an improved environment, I think the question is not why is it why was it so high? It's why hadn't people figured this out before? Because I think in those communities, perhaps because black folks, Latinos, Asians disproportionately live in communities that suffer from environmental degradation, toxic sites, lack of parks. They know better than anyone the value of clean air, clean water, green space, and given the chance, they will act to improve the environment. The environmental justice movement is now 20 years old, and the environmental justice movement arose in significant part because mainstream environmental organizations have disregarded the interests of people of color, and their policies often hurt people of color. Indeed, Jim mentioned earlier in terms of funding, the former president of the Environmental Grantmakers Association about a year ago published a report on why the environmental movement is failing, why the mainstream environmental movement is failing, documenting the fact that the more committed to the environment a foundation is, the less likely they will fund environmental justice, social justice projects. So I think, again, it's a question of lack of resources in communities that need improved environment the most, lack of attorneys, and given the chance, they vote to tax themselves. And aside from that, the LA Times did a survey of Asians and Latinos. I don't know why they left out blacks. And Latinos and Asians in California overwhelmingly are more concerned about the environment than non-Hispanic whites. So I think it comes down to they see the need more than anyone. And then we built that into the message so that on Prop 40, as I mentioned earlier, I was on the executive committee, and we were tasked with getting that message out, but also going to non-traditional partners and bringing them to the campaign. And that's a huge part of what we do, is bring non-traditional partners to the environmental movement, to the health movement. So the messaging and the outreach are essential, and I think the interest is already there.
Don, do you want to add?
I think as Bob said, the key issue is people having the opportunity to have a voice. So I believe that there are two lessons from this. One is, if people have a voice, they vote in a particular way. And two is that people can have a voice. And California has, and some other states have, the wonderful opportunity to have propositions, to have referenda, essentially. That isn't the case in every state. And figuring out ways to give people voice is critically important and differs across jurisdictions. The second thing is, as more and more communities and, in fact, states become majority-minority states and communities, I expect we may hear more of the voice of people who recognize why it's important for them to have access to appropriate food and physical activity opportunities. So, as people have said, the arc of justice, well, the curve may arrive as our population changes, and people then demand that they have a voice to express their preference.
Eduardo, would you identify yourself before making a comment?
I'm Eduardo. My name is Eduardo Sanchez. I'm on the standing committee, and I work for the American Heart Association. Several weeks ago, I read, actually with some dismay, a report that came out talking about sugar consumption in the United States and pointing out that, indeed, it's about a third of the excess sugar consumed in the United States is in beverages, which suggests that there's a significant amount of sugar consumed, and I think we would agree that's been added into foods that maybe you wouldn't have thought has sugar added. Tom Robinson has talked about stealth initiatives about how we make health, how we hide the positive aspects of behavior or activity or anything we're doing. This is kind of reverse, stealth sugar in the food supply, and I just wonder how, I mean, and it's consistent with our recommendations to eat more fruits and vegetables and reduce added sugars and reduce even beverages. The challenge, and I just would like y'all to talk about it, is those off-the-shelf items that people don't realize have added sugar and are therefore adding to the challenge we have to address obesity.
Mary?
on the nutrition facts panel, it would be a lot easier for consumers to understand what is actually added. Right now, the nutrition facts panel just has total sugars, which can include naturally occurring fruit juice, obviously as natural occurring, but there's no way to decipher what's actually added into foods in terms of the sugar category. They have saturated fat and trans fat, et cetera, but not added sugar. I think the Center for Science and the Public Interest has had a petition in front of FDA for probably close to a decade to urge them to look into adding added sugar on the nutrition facts panel. We know FDA is struggling with that right now. It's really difficult to really be able to well, we've heard it's difficult to ferret out, although food companies can certainly do that. It's a matter of whether or not is there proprietary issues involved. So I do know FDA is working on updating their nutrition facts panel, and that is a priority issue for them, and one I think is probably causing the most complicated discussions is the added sugar, but it is pervasive. It is in a lot of things. There are tricks consumers can do now to look at certain ingredients. If it says any kind of sugar, high fructose corn syrup, et cetera, in the ingredient label, but that requires a little extra time, and we all spend about 7 seconds at the point of purchase in the grocery store. So to kind of layer that on top of it makes it a little more difficult.
Mary, did you want to add?
I agree. I think that there really needs to be a big petition to FDA to really include added sugar on the label, because right now, like the field flavors are not.
Turn it on and move it up.
So right now, like with chocolate milk, there's no way to tell how much added sugar is in milk, or even yogurts, because milk contains, natural milk sugar. So I think, a write-in campaign to FDA could really help. But still, the largest source of added sugar in the diets of kids is by far sugary drinks, much more than, any other food. So I think that we really need to concentrate on that. But right now, parents, they have no way. There's so many different forms of sugar that if you look at the back of the pack, it's really hard to really tell what's in it.
Don?
The other thing just to mention is portion size. So yes, there's added sugar. Yes, it needs to be labeled, but the other is we have remarkable portion sizes. And figuring out how to reduce portion size and clue in parents to appropriate portion size, I think, is also a critical piece in reducing sugar in children's diet.
Next questioner here.
Yes, I'm Joni Eisenberg with the DC Department of Health, and I have 2 questions. One is, we certainly know the impact of media on promoting unhealthy food choices to African American and minority young people. What can we do to better promote a national media campaign? How can we get the resources to use radio, TV, such as was done in Philly, radio, TV, social media, effective campaigns that utilize young people and others to create this campaign, such as was seen with the anti-tobacco campaign.
Don, do you want to start?
The one thing I can say, I will give credit to the Centers for Disease Control for trying to identify effective campaigns from around the country and then make them available. There aren't that many campaigns that have been shown to be effective in terms of obesity prevention. So getting evaluated campaigns and putting them into the public space so that other communities can use them and not have to go through the expensive process of development is one really important piece here for a national effort. And I think that's happening and should continue to. A second is any funding that comes from the private or public sector for new media campaigns should be evaluated so that you don't have to create your own campaign, but there are campaigns that can be coordinated around the country that we know are effective. And effectiveness, I think, is critical. The industry has lots of money to look at effectiveness, and they know pretty well that they'll get a 2% change in their market share or a 0.03% change in their market share by marketing on a particular issue. We in the public sector and those who are opposed to marketing sugar and other things have no idea what happens in terms of public opinion and what are the particular segments we should target with particular campaigns. That information needs to be generated as well.
Tracy.
I think a couple other things on the sort of macro level. Right now, there is something called the Children's Food and Beverage Advertising Initiative that has a set of standards for companies that opt to participate in the pledge. Those standards are weak, and they really need to be strengthened. There was an interagency work group comprised of the CDC, FDA, USDA, and FTC that came up with some very strong standards, but the industry didn't like them, Congress didn't like them, and that was shut down pretty quickly. So we do need a strengthened ability to really only market healthy items, or certainly to limit it, to eliminate or decrease unhealthy marketing. But also we need to expand the marketing definition. What do we mean by food marketing? We need to kind of carry it into on-pack marketing. We need more media companies to step up to be responsible. So there's a lot that can be done, but it's also a pretty heavy lift. So in the meantime, I think a lot of the efforts that Don just talked about are also going to be necessary. But this is a problem. I would say stay tuned. Lori Dorfman and that Ellen's panel tomorrow is going to be talking a lot about targeted marketing and hopefully also talking about what can and should be done in that space.
Over here.
Sheila Fleischaker, NIH. I first want to thank Jim. I love when we have active applause. I always am very happy when you're at meetings because it's at least 90% of us, I think for the most part, get to stand up and clap, so I do appreciate that. Although as a pregnant woman, I'm not as happy coming to spaces where we can't drink water. But anyway, I also want to thank Shariki and the committee for dedicating this meeting to Tony. Instant Recess has really instantaneously taken off with the tribes that I work with, so it's just a small example, I think, of little things that researchers can do to kind of get communities active and kind of make things their own. With that, on the active living side, I wanted to ask you, panelists on the active living side, to address how you frame things a little bit more effectively on the community development side. I feel like the materials on active living and the strategies aren't as good compared to healthy eating in terms of making that argument, particularly with the tribal communities I've worked with. You know, it really wasn't until a tribe made over $3,000 beyond in-kind sponsorships that idea that they can make money off these type of strategies really came to fruition. So I was wondering if you can speak to research resources relating to the economic development issue. Also on the active living, I wanted you to address, and I think you guys were partly talking about this where you were seeing that there wasn't, in some areas, an access issue, like Chicago, for instance, where I'm from. Parks are throughout the city in, low-income and high minority areas. Where I see some of the differences is the parental involvement and support to some of the programs that kind of take programs to the next level. And so I wanted you guys to talk a little bit about the parental role in terms of making effective use of parks.
Jim.
Okay, maybe I'll start with the materials coming out of active living research. Our focus has been on taking the rapidly growing research on active living and making it accessible, I would say, to relatively educated but non-scientist people, right? So focusing more on practitioners, policymakers. So we've recently gotten feedback similar to what you were saying, that, well, the people right on the front lines in the communities also need access to this material. And so we could do a better job in making it simpler, more visual, more languages, and doing that. So this is on our agenda now. So we are going to be working on that, and hopefully you will see some new materials coming out. The other question, maybe I missed a piece in the middle, but from the point of view of parks and parental roles, I think, to me, a piece in the middle there is the parks having programs and supervision so that parents feel comfortable letting their kids go to the park, right? So it's a pretty big burden to place on parents. Okay, you've always got to accompany your child to the park. If there were the organized programs and supervised programs, especially in low-income neighborhoods where crime is a particular concern, I think that would help out the parents. But certainly, so what we're finding that Myron actually diagrammed is you've got to have a park. It's got to be designed so that it supports activity. And then you have to have programs, but then you have to promote the use of that park. And a lot of that promotion to get kids there needs to be focused on the family. But Robert, do you have a comment?
Very little. I'm an attorney, and just doing a presentation like you saw today, instead of writing a dense legal brief with string citations in proper blue book form, has been an evolution in the kind of work we do. One. Two, public television, PBS did a documentary about 6 months ago on the state park system in California. KCET, which is the local public television station in Los Angeles, has done 2 9-minute documentary videos, one called Park Poor, and the other, I forget the title, but it's about reforming the way parks are funded. So video documentaries, I think, reach a lot more people than certainly a legal brief or the kind of posts we do on social media and blogs. So that, with translations, it's expensive to translate our work into Spanish, but we translate key documents into Spanish because so much of the community that we serve is Spanish speaking.
Next question.
Sure. I'm Tom Robinson from Stanford and Lucille Packard Children's Hospital, and a standing committee member. And I guess I'm going to start with a little more of a comment and maybe a bit of a rant or a nudge. But well, actually, first want to say that it felt really good to stand up to ask a question. So if anyone else wants to stand up, it's a good, I can tell you from my experience, it feels good. But when I look at the presentations from this morning, I see that the advocacy in the public health community seems way ahead of us as researchers. They're actually implementing programs really in the absence of a lot of good, as we just heard in one of Don's responses, without a lot of good evidence for what they should really do specifically to reduce disparities, what populations they should target, what their specific interventions should be, how to invest their resources in different ways, and what are the best things to go after. And it feels like this is not, this is something that in the health world, we seem so focused on addressing these disparities from an observational point of view, that it seems somehow we're satisfied if we show that there are differences between groups, that's good enough. And maybe it is for changing laws and changing policies, but it doesn't really tell us where the most efficient way of investing those resources are, where we should target. And this isn't the case necessarily in all fields. When you look at education research or you look at child development research, for example, there's a lot more experimental research that actually tells you how to reduce disparities, that's trying to reduce disparities as opposed to just documenting. And I guess this is 2 questions. One, to those of you in advocacy or public health positions, is does it really matter? Is documenting the disparity good enough for making the changes you want to make? And for, I guess, because Jim and Mary are up there, put you on the spot a little bit. But, we've been doing healthy eating research, healthy active living research for, a decade or so. Where's all the research where's the experimental research, the solution-oriented research that is more than just ending up with the conclusion that if we build it, they will come? Because that seems to be the same state we seem to be in the same state we were a decade ago in terms of looking at environmental determinants or environmental interventions, in that we haven't really cracked that code in terms of what are the interventions that work, how do we do them, who do we apply them to, and in what context.
Don or
and
Tracy?
Yeah.
Go ahead. You done?
Yeah.
Don or Tracy, would you like to start, and then
rant.
Jim or Mary can take the second half?
So I would only say that in terms of your reference to child development, if we look back 30 years, when the infant health and development study was going on that documented early intervention worked. It happened, that study happened, after probably 30 years of research that was done on individual children and in small samples. And finally, the Robert Wood Johnson Foundation and the federal government stepped up, as well as centers around the country, to do a larger study and prove what worked. I think we're probably, 50 years behind that in terms of where we are in understanding how to implement something in a standard way across all these diverse communities, across all these diverse jurisdictions. And we're not talking about working at the individual level with this. We're talking about the environmental level, where we have both the political process and we have the diversity both of people and jurisdictions. So the complexity is different. I appreciate your impatience, and I really echo the impatience. But I have to say, when Philadelphia has looked at what's out there, what's the standard of practice, where are we not the alpha site, and where can we be the beta site, there are precious few places where we have alpha site data at scale. So I think we're at the point nationally where we're just going to scale. And the next step's going to be to understand how the scales are different, and then to figure out, is there some more formulaic approach here that we can use for more global policy? And I think you've heard lots of good advocacy, both around parks and nutrition. And we've also heard about the fights that are going on in Congress, even with good data and good evidence about what works in terms of nutrition. Look how hard that is to move forward at a national level and get people to invest in what works. So we have both political hurdles and I think we have scientific hurdles. Both are being worked on, but I agree with you. We have a ways to go and it's frustrating.
I think that both HER and ALR, have plenty of examples that where the research that's been funded by the Robert Wood Johnson Foundation has really informed or led to policy change. But I think what could really accelerate that is that we need to have a better link to advocates and people like Don and you that could really link that. What evidence do you really need to really inform policy and really to move things forward? And we don't have right now a real systematic way to really get input quickly as to what those most important issues are. Because if researchers will follow, researchers, they really need to know what the most important research questions are. So I think we can come up with a better pipeline to really achieve that.
And briefly, if I can comment on the research progress, I think there has been both progress and challenges. So over the past few years, we have focused a lot on getting beyond cross-sectional studies and documenting problems. And we've had several successes, I think, in park studies where basically followed parks after they were renovated, before and after they were renovated, with parks that were not, and shown improvements in use and activity in those parks, and done some similar things with trails. And then we are going beyond cross-sectional and seeing some successes that if you improve things, you see some outcomes. But in other areas, we're having difficulties. Several, we've evaluated some policy changes in schools and daycare, and some of which have positive outcomes and some of which don't, both are useful to learn. In some cases, people have said, all right, here's an opportunity to evaluate a change, and it was not judged to be big enough, to put in sidewalks on a few blocks, to expect much outcome from that. In other cases, changing a built environment just takes years and years, way beyond the scale of grants. And so we haven't figured out a way to do adequate evaluations of those. So I think we are making progress, but some of the difficulties remain.
Next question, Chris Collins.
Hi, Chris Economos, Tufts University. I'm on the standing committee. And if you do want to ask a question, I'd suggest coming to the right, where you can probably get to the mic a little faster than the left. So my question is really about the story from Los Angeles and Philly and the community engagement that occurred underneath. You alluded to some examples of messaging, translation, but these are big changes that occurred, and they couldn't have just been top-down policies or legal action. They needed to engage the people living in those communities, and you said that they did. But we don't have a lot of evidence of those practices working, which I think makes scalability and replication difficult because it is often specific to the community. However, my experience, and probably yours, tells us there are some key strategies that we could share. And I'm wondering if you could go a little deeper and talk about what it took. Public forums, through the schools, working with ethnic minority advocates. How did you actually engage the people that lived in those communities to make these changes?
I guess I will start by admitting I don't know how well we have, shocking as that may be. I think retail in communities and institutions, parks, recreation centers, schools, and others, so institutions in communities, have been engaged. And in part, that has to do with resources, and it has to do with convening of those groups, which is a whole lot easier than convening individual groups of folks on blocks. But what I will say is, I think if the retail environment and the school environment and the regulatory environment and those things that affect communities as they affect parks or recreation and touch real people change, and people begin to see change, they begin to feel that change is possible, and they begin to pay more attention. We have a randomized controlled trial in Philadelphia where lots were cleaned up on individual blocks. So randomly assigned lots that needed to be cleaned up were cleaned. And the folks who cleaned them up with city government tracked how safe people felt and how much they were walking. And if the lot that you've screamed about on your block gets cleaned up, you're more likely to walk, and you feel safer on your block. Well, it's not rocket science, but it does say we can engage people by doing what they feel is necessary for their environment, and fixing that environment means that they're empowered in a certain sense, even though they may not be conversing specifically at an individual time. And then I think the conversation occurs. People want it to continue.
We're down to the final three questions. Did someone want to follow up? I'm sorry.
Can I just
Robert.
briefly say, I appreciate your concern about how you engage the community, but it's not simply that there are these isolated stories from LA. Ultimately, as I say, I am a civil rights attorney. Brown versus Board of Education is the paradigm of how to achieve social change through law. And I was an attorney with the NAACP Legal Defense Fund. I'm very proud of that work. I think LDF was the finest civil rights law firm of the 20th century. And what's different now is that going to court is not our first or only tool. We will do it if we have to, but there are the other strategies still based on the civil rights movement of coalition building, translating research into law, media, policy advocacy outside the court. So Legal Defense Fund did not achieve Brown v. Board by itself. Right. Martin Luther King was the community side of the civil rights movement. Thurgood Marshall was the lawyer side. Both are essential, and the civil rights movement does offer lessons for the health justice movement.
Thank you.
We're down to our final two questions, which will be among our best, and you'll be able to tell us because of their incisive brevity.
Gary Thermalia, Philadelphia Department of Public Health. This is a question for Robert. Are there civil rights-based approaches that we should be taking around nutrition? And what are the responses from the other panelists about those ideas?
The short answer is yes. And for example, about 2 months ago, the California Senate, of all people, issued a report documenting that they had audited 13 school districts in California that were misappropriating federal healthy food funds for other purposes. They were literally taking food out of the mouths of babes first of all. And they said, this is only the tip of the iceberg. In fact, we don't know how big the problem is because there are not enough auditors in California to do the required audits. So most districts haven't been audited. And when we did reach out and do these audits, people in school districts told us, we were told if we told anybody about this, we would be fired. So that's a huge issue. And you know it's a civil rights issue and a disparities issue because healthy food funds are, by definition, targeted for free and reduced meal, people who qualify for free and reduced meals, who are disproportionately low income and disproportionately of color. So there are huge disparities, huge opportunities, and the bigger question is what funding and resources are there for civil rights lawyers to address them. Our biggest challenge is not finding problems. Our biggest challenge is finding the money to attack the problems.
The only thing I would say is that we're struggling with this right now in Congress with regards to that right there as just not recognizing that having access to food, certainly healthy food, is an equal rights issue. That doesn't resonate at all, certainly in certain camps of Congress, and I think that's why you're seeing this sort of outright fight against SNAP and those who are really unable to have the resources to purchase food, and there doesn't seem to be a real frankly, concern among certain camps about the fact that, food is an equal rights issue, and we're seeing that play out, unfortunately, on the halls of Congress right now. So I think it's a good point to bring out. I really do think in the nutrition community, we oftentimes think, well, we need to get people healthy food. It's really important. It's a public health issue. It's much more than that. It really is a civil rights issue as well. So I think that's a good point.
Last question.
Russ Pate, University of South Carolina, a member of the Standing Committee. I want to raise the issue of neighborhood safety, which I think is probably exerts a powerful and maybe not very well understood influence on kids' physical activity. Myron showed that there's a cross-sectional association between crime and people's likelihood of using a park. It seems to me this issue really has two parts. Part of it is the reality of the safety that may exist in an environment, whether that's crime or traffic related. And then the other part is people's perceptions of the safety. And so my question is, what evidence or what experience do we have that would indicate that if we reduce crime or improve traffic safety in a neighborhood, that it influences physical activity and it influences parental perceptions of the safety of the neighborhood? I'm concerned that we could improve a neighborhood, but if the perception or the reality is still not safe, we won't get the outcome that we're looking for.
There's some limited studies in LA, but I think I mentioned this, the Summer Lights program. Kaiser Permanente funded keeping lights on in targeted parks where the level of gang activity was highest, keeping the lights on till midnight during the summer. And they did a study, and they can measure the drop in crime around those parks. That's good news. Again, the bad news is they turn the lights off in the fall, winter, and spring. 1. 2, at Rio de Los Angeles State Park, which you saw in my first slide, it is in the heart of Northeast LA, which is a high-risk neighborhood. And the park is surrounded on the street side, on one side is the river, on the other side is the street, by this beautiful berm with natural plants and so on. And I was, like 3 or 4 years after the park was there, I was talking to the director of the park, and I said, is it true those berms were put there to prevent drive-by shootings? And he said, yes. Because I thought it was a beautiful design feature. He said it is a beautiful design feature, but it was motivated by preventing drive-by shootings. So the design makes a difference, and there is empirical evidence that parks work to keep gangs, children out of gangs.
Maybe just one quick comment. This link between crime, perception of crime, and activity or being out in the neighborhood is very unsettled in the research. It's completely inconclusive. There's studies showing all possible positive, negative, zero connections. I think I just echo what Robert has said. There's a little more evidence, probably only from case studies at this point that I'm aware of, showing that physical activity in a neighborhood or in a park is a way to reduce crime. I think that we have a little bit stronger evidence from that point of view. So I think that if you reduce crime, it takes a while. Everyone would expect it to take a long time for that reputation or the perceptions to change. So I would actually like to see studies promoting activity in neighborhoods, more like Robert was saying, and look at the effect on crime and perceptions of safety.
We now have 4 formal presentation statements that were pre-prepared, of which we have been advised, and the first will be by Siobhan Arlene Bradley of the NAACP from either of those 2 microphones.